We're a couple of minutes past the hour, so I think we can go ahead and get started. Welcome to our third Thursday webinar for May. My name is Brooke Gentry, and I'm the AOT Implementation Coordinator as part of our implementation team. And joining me is Betsy Johnson, who's also a member of the implementation team, and Kim Kehl, our fabulous presenter today. And so thank you so much for joining us. For those of you who did register for this not through our AOT Learning Network, I would definitely encourage you to join the AOT Learning Network. I will drop the link for that in the chat, but it is a virtual network where you can get access to webinars and educational offerings like this one, and also connect with AOT folks doing AOT and connected to AOT across the country. And so you all will be camera and microphone off for this, so no need to worry about what you look like. And Kim is going to present, and then we will have a Q&A after the webinar. So you can, as the webinar is going on, you are welcome to submit questions using the Q&A function or through the chat, and then they will be addressed at the end of the presentation. So with that, I am going to hand it off to Betsy to introduce Kim.
Good afternoon, everybody. As Brooke said, my name is Betsy. For those of you who I haven't met yet, Amy, our other colleague, is unable to be with us today, so she sends her regards. It's my distinct honor today to introduce our special guest and speaker, Kim Kehl. Kim and I go way back. I've known him for many, many years. We've been in and out of state government together. And he's held a number of jobs at a variety of state agencies, including Education, Department of Mental Health and Addiction Services, Job and Family Services, Health, Transportation, and the Governor's Office on Family and Child Services. He's just a wealth of information. Kim, I gotta say, was the first person, probably 20 years ago, Kim, you were the first one I ever heard the term cross systems collaboration. I mean, you were talking about it long before it was cool, long before that phrase was probably even coined. I mean, that's been your mantra for years. So it's good to see it's really paying off all these years later. So today, Kim is considered Ohio's foremost expert on trauma-informed care. He's trained probably thousands and thousands of individuals throughout the state and probably throughout the country on trauma-informed practices. It's no surprise to me personally that Kim has chosen this to be his his area of expertise. He is by far probably the kindest, most empathetic person I've ever had the pleasure of knowing. I'm fortunate to call him a friend, and I'm so excited that he's going to speak with us today about this important topic. So Kim, take it away.
Well, great, Betsy. It's, you have a special place in my heart too. So I'm honored to spend a little bit of time with you today to talk a little bit about moving towards this trauma-informed approach, control, connection, and meaning. It's not anything of my original thinking. It actually comes from Judith Herman's work in her pioneering book back in the early 1990s about trauma and recovery. So we're going to spend a little bit of time sort of talking about a little bit of foundational work and understanding trauma. And then we'll move into some sort of specific stuff around what does this look like? And these are merely suggestions. I'm certainly no expert. I just, in my job, previous to what I'm doing now, which is actually working for our Department of Job and Family Services on helping our kid residential centers implement trauma treatment models and moving agencies to trauma-informed agencies. Really, the benefit to my job is I get to travel around the state and collect stories. And it's really about stories of resiliency. It's about stories of people who really have figured out that every one of us comes at this with our own backstories and the things that we bring. So I know that you all probably have been trained in basics of trauma and things around self-care, but it seems like we always should start with a disclaimer, because we never know. We never know when we're going to be in a situation where I think I've talked about this and I've learned about this and I've had lots and lots of discussions, but today may be that day where there might be something said or something shared that just hits a little bit too close to home. So none of that is done intentionally. This is not forcing you to take a look at your own personal stories or your own journeys. This is simply just a disclaimer, like we need to be prepared and we need to be aware that sometimes things are said that all of a sudden sit home and hit home really close. So it's not done intentionally. It's just sort of part of what we're going to do. I think it's important that we sort of ground, because I don't know about you, but after the last 3 years, 4 years now, we've all sort of experienced these different adversities and traumas in our life. So I think the world has gotten big about this. And I think it's really important for us to sort of get grounded in what the pioneering work was. And there were lots and lots of studies way before the ACE study, but the ACE study really sort of quantified this and was the springboard for moving forward. And you may know, so we're just going to spend a few minutes what that was like. You know, there was a pioneering study that looked at essentially 3 areas of adversity that occurred in kids before the age of 8, abuse, the age of 18, abuse, neglect, and household dysfunction. And they learned in that study of over 17,000 people that people who experienced those adversities, the more of them that they had, and the more frequent they had, the greater likelihood of developing things later on in life that were particularly challenging, risky behaviors, physical issues, mental health issues, and certainly other negative outcomes that really drove people to needing support and services from various systems, not the least of which are substance abuse and frequent contact with the criminal justice system. This slide represents what that original ACE study looked at: abuse, neglect, and household dysfunction in these 10 areas. And we know that abuse and neglect are really individual things that people experience individually. Household dysfunction was me as my participating in a group, family, a community. It was part of me belonging to something. And those areas were mental illness, someone in the family being incarcerated, mother treated violently, substance abuse, or divorce or separation. The more of those things that people experienced in that study, the greater likelihood, and things that showed up later in people's lives really affected their behavior, choice making, and how it manifested itself both physically and mentally, with things like heart disease and cancer and stroke. And usually when we get to this point of understanding this, that's where the commonality and that's where the collaboration starts to come in. Because when you stop and think about, and you say to somebody maybe in the child welfare system or the older adult system, all of a sudden these things are starting to show up in people's lives that certainly there might be a medical diagnosis, but things have been accentuated and could be related to what people have experienced in their life as a kid or as an adult, or certainly as a senior adult. And we don't have to look too far about what we've all experienced collectively over the last 4 years and kind of figure out, now I get it. We know that there's a lot of other studies that have been done. So not only is the ACE study pioneering, but there have been lots and lots of replications of that study over numerous groups of folks and numerous populations throughout the world, and it remains the same. The outcomes are the same. The more adversities and the more traumas that people experience, the greater likelihood of things showing up in their lives later on in life. Those other studies certainly have indicated that those traumas are much more than abuse, neglect, and household dysfunction. Here are just some examples of potential traumatic events that really could be potential explanation for people's behaviors and the way people interact with and how they present to various systems, how they try to interact with their own family, their neighborhood, or their community. You could probably add to this list because the list keeps growing and growing. The things I think that are important to pay attention are this notion of chronic stressors, of poverty and racism. So just where I live, my neighborhood or my community could have an impact on the way I behave, the way I interact with people. And if I'm a person who has a severe mental illness, a severe persistent mental illness, that just makes it much more complicated because I'm in that community and those things around me are going on. And so this is really helping us understand the way that people come and the way that they participate. I think about really the Catcher in the Rye, and you're thinking, what is he talking about, Catcher in the Rye? I don't know about any of you, but I don't know. I never read the Catcher in the Rye, right? I cheated. I used the Cliff Note version. So the Cliff Note version is really everybody has a backstory. And it's important for me to know that that backstory may be explanatory for the way I act, the way I try to be in connection with people, the way I try to demonstrate meaning, and the way I try to have some control over my choice making, the way I have some control over the way I act or interact with other people. So this is really the Cliff Note version is everybody has a backstory and it's important for me to do it. So this whole science of ACEs or this whole science of trauma is really sort of this new lens through which we can better understand people's stories, right? The way we suffer or how we suffer, why we suffer, how persons in the human service systems are treated, supported, how they move towards personal wellness. It's really about how we might better prevent, treat, manage illness within our own healthcare system. If we could minimize the exposure to adversity and trauma, and we think about how those outcomes sometimes are high cost healthcare needs, maybe we could use the money a little bit differently, use it more for prevention and earlier intervention. It also helps explain how we can recover and heal on deeper levels and really about hurts that have to be healed. So we know, and the research is pretty clear, that trauma seems to be an overwhelming negative factor affecting many people who come to court. I remember doing this presentation for the City of Columbus legal division for all of the prosecuting and defense attorneys, and opened the beginning of the training session with asking the question, have any of you ever had a non-cooperative witness? Of course, everybody raised their hand, right? And there's lots of reasons people don't cooperate, but when you stop and think about how many times people who have had adversities and trauma come to the system, and how many times they just have to tell their story, and they look at us who are the professionals saying, do you people ever talk? Do people ever communicate with each other? From the treatment court participants, adverse childhood experience seemed to be present in almost all cases. And tragically, many people leave the courtroom worse off because they've experienced this notion of jurogenic harm. So those unanticipated harms caused by the justice system. And we're going to take a look at a few case examples here in just a little bit. We're going to continue to sort of set this framework. So why is it important? Why is this important for us to think about trauma-informed responses or trauma-informed practices? First and foremost, of all things, it has the ability to help us create a safe space, safe place, and really, quite frankly, being able to maintain safe relationships. A lot of the work is done by these 6 principles, SAMHSA's principles of care. And its first and foremost principle is around creating safety for people who are participants in systems. Helps us to work with individuals with mental and behavioral health challenges. Again, to increase an awareness on the impact of trauma on people's behaviors. Helps us to avoid re-traumatizing people just by the way we interact with them, and how we can reduce recidivism and promote recovery. So looking at a trauma-informed approach helps us to look at the entire person, not just what we see in the court, not just what we see in the treatment arena, not just what we see in particular settings, but it really helps us look at the entire person. What is that person's backstory? What are they bringing with them that may be explanatory for why they're not engaging? Outside of maybe their inability to do that, but why is there something going on today that's different from them? It helps us to understand the people who are in front of us and who we're working with, understand the trauma of a courtroom and just the judicial proceedings that people have to go through. Helps us to understand and craft specific rulings that are equitable and do the right thing. We were working with a court not too long ago, a juvenile court in Mahoning County. And one of the things that they did, and I got to see this, we were taping a series for juvenile judges, and I got to see this actually happen. So the sheriff people were bringing a young person from the detention center into the courtroom or into the courthouse, and the first thing that sheriff escorting that person said to the young person who sat down and waited was, "Hey, the judge will be starting in about 10 minutes. And you could see a sense, and I got to see this, I have no reason to make this up, but I got to see that young person sort of take a deep breath, right? Like he knew that something was going to begin, and he had a relative amount of comfort in knowing that it was going to be in a shorter period of time. And so some of that anxiety that would have probably come along with his behavior seemed to be minimized. We were working with another court where they have a schedule and people can see what time they anticipate their docket being brought up before the judge. And that really seemed to help. You know, when you think about control, connection, and meaning, I have an ability to have a sense of control if I know about when I'm going to be coming into the courtroom, if I know and someone has explained to me what the process is going to look like. So I begin to have that sense of control, connection, and meaning. So it really can help the legal process and the court demeanor or those sort of outside behaviors about focusing on compassion, understanding, and respect, about being genuine, not aggressive or assaultive or punitive. And there are certainly instances where safety may dictate that we have to be a little bit more hands-on, but it really minimizes that prospect of happening in a courtroom if we know that people are coming in with these particular challenges and these particular things that may help us understand their behavior. It gives us a demonstration of being able to say, we're here, we really want to help you. And we want to prevent the cycle of what has happened when people who come into the justice system, because we know that oftentimes when people come in for the first time, there's a greater likelihood that they're going to come into contact with the justice system again. It's about establishing a relationship of trust, and that's going to take time. It doesn't happen instantly. I was thinking about some training we were doing again with a court system, and we came in and said, you know, this is a safe space. This is a safe space. You're allowed to share whatever you want to share. And I thought, wait a minute, that's not being very trauma informed and not very trauma sensitive. I'm saying to you, who you don't know, you've met me for the first time. And part of my experience has been, there have been lots of people in my life who said, this is a safe place. And we know sometimes what the stories of those supposed safe people were, right? They weren't. People were treated wrong, they were hurt, were violently hurt, they were sexually abused. I mean, we know those kinds of things. So even in my own practice and in my own training, in my own working with agencies or courts, I have to be very careful. And it caused me to think, wait a minute, I can't use that word, this is a safe place, because I just met you. So how do I begin to establish that level of trust, that sense of connection and meaning that we know, Judith Herman says, gets disrupted by people who have experienced trauma and adversity. So a trauma-informed response is really, and you probably know this, but I think it's a good reminder, it's changing the way we think from what happened to you instead of what's wrong with you, right? We know how many people come with volumes and volumes and volumes of paper and records, and sometimes we have failed to ask that underlying question of what happened to you. Instead, we're always wanting to go towards what's wrong with you. And I think tragically, our systems are set up that way. And they're set up that way because the financing happens and it's billable. Asking the question, what happened to you, is not billable, right? And so we really have to start to figure out, how do we get to that question, and making sure that that question is deliberately asked, not in that first time that we meet with someone, but after we've had the ability to provide a way for people to feel safe to ask that question of what happened to you. So here are some hallmarks of what a trauma-informed court or a legal process might look like. It's about identifying trauma, adjusting relationships, and adapting strategies that are responsive to those relationships and responsive to the fact that we've identified that people have had trauma or adversity in their life. So a client's trauma history may affect and represent making it difficult to get the whole story and a consistent story, because our systems oftentimes ask people to repeat these stories that are sometimes devastating, sometimes are hard to repeat, whether I'm the perpetrator or whether I'm the victim, right? Repeating those stories over and over again, just oftentimes just like, I don't want to do it. And in that, if I keep asking, and sometimes we know that people have to repeat those stories many times in one day. And so those stories begin to be inconsistent and we don't get the whole story. The client can experience some shame and hopelessness or have traumatic flashbacks based on the questions that we ask them, based on the way that they come in, based on the smells and the sounds and the feel that people have, right? Because they may be triggering. I think about this one court that we were working with. Actually, we're trying to figure out how they could encourage their staff to come in not wearing any sort of fragrance. Their thought being that for some victims, that could be very triggering, right? If I'm a person who has been perpetrated and has been a victim of sexual abuse, that particular fragrance may be very triggering for me. So those were some simple things that court said, hey, maybe there's a way that we could do this. And they did. Staff agreed to not use fancy colognes or perfumes when they came to work. So it's quite common for a trauma survivor to present as withdrawn and with flat emotion, or the opposite of that, right? To be flooded with this overload of information, or to be angry or suspicious based on their own experiences that they've had as a child, or really as an adult too. So identifying trauma is also about the ability to communicate with clients and develop a relationship of trust. And I think it's really important that people understand, like, I don't have to be a therapist to be therapeutic. I don't have to be a mental health expert to respond in a way that recognizes what the client is describing or the behavior that the person is exhibiting is indicative, in fact, of their trauma and their adversity that they've experienced. Unless a practitioner has a previous professional background in trauma practices, they tend to not be particularly aware of how trauma is defined or how it presents. So again, I'm just going to go back to the simplicity of understanding that people have a backstory. Arguably, I think that it could be important to just have a universal assumption now, more than ever, that people have experienced stuff. They've experienced that stuff. I would use other words that are probably more trauma specific, but we'll leave it at that, right? People have experienced a lot of stuff. And so I think more now than ever, we have to be very cognizant of what that looks like. And once again, we have to keep reminding ourselves that this is about safety and how people feel safe. So knowing that, how do we start to think about adjusting our relationships? So we know that this also is not something that we do overnight. This requires time. This requires an investment of both money and time and strategies to really change the way that people, particularly with severe and persistent mental illness, come to the court, and how we respond to them, and how do we respond to the people who are involved with that individual. And oftentimes there aren't people because of the histories that some of the folks that are involved in AOT and other strategies, sometimes there aren't people there that have, those relationships have been strained. Those relationships have been compromised. Transparently engaging the client in developing solutions can be very empowering, and we're going to show maybe just one or two examples of how you can do that. And are there ways that are really non-legal solutions that we can get someone into a therapy or an intervention that is sensitive to understanding trauma and its impact? Going to court itself could be really re-traumatizing for people, and it doesn't take too much to see that happen. For people, they're automatically assuming that this is not going to go well. My experience has not been good because people don't usually show up to court because it's a good day, right? People with traumatic experiences, we know, can be terrible witnesses or non-cooperative witnesses at all. And I think part of how we can do that is to really helping a person by desensitizing and rehearsing with them over and over. And you may do that, but how do we do that? Understanding that if I'm asking that person to tell their story over and over, is there a way that we can tell that story that helps that person to feel safe and in control and feel connected to what they're doing? And give some extra thought on how the client will be able to testify about those experiences in court. I think it's also important, and you'll be reminded here towards our time as we end, about how this affects us too, right? In the people and the work that you do, we know that this really affects us. We don't often want to admit it. We don't often take time to acknowledge that, but we know. And so working with a client on how they can testify, telling those experiences, helps us ourselves to figure out how we can take care of ourselves in working with the people that come to us. So what does this look like? Here's just a simple list of what this might look like for someone who has experienced trauma or adversity, pronounced sense of anxiety. They may misinterpret nonverbal cues, things that are going on around them, disproportionate responses to expectations or social interactions, anger, disassociation, the inability to stay focused and retain information, and difficulty in making decisions. So let's take a look at just a couple of experiences from the perspective of a person with severe mental illness. So they're coming into the court, the metal detector goes off, and the officer gruffly responds. Person with severe and persistent mental illness becomes agitated, confused, and decides to leave. So what might be an alternative? Working with a trained person at the door, they can calmly and respectfully explain the process for entering the building and the procedure for what happens if the medical detector goes, if the metal detector, not the medical, the metal detector goes off. But you're saying to me, wait a minute, we're a large metropolitan and we've got thousands of people coming through our court every day, of which persons with severe mental illness. How do we take time to do that? It doesn't mean that you have to do that for every person, but I think as you see people coming in who are more clearly agitated, a simple procedure to say, hey, this is what you're going to do if the metal detector goes off, we're going to pull you off to the side and we're going to make sure that you are safe and we're safe coming through. I think it can be done in a relatively short and not a real demanding amount of time away from how the process and the procedure is going on within the court. So what about an AOT participant who gets bad news? They become argumentative with their attorney when the judge extends the court order, right? The person becomes angry because they feel they are being punished. An alternative could be the lawyer prepares the person ahead of time that this may be the outcome. You may get some bad news, but that the team is really concerned about you. And even though you want to flip them off, even though you want to leave, even though you want to exert your behavior and stand your ground, you may want to stay involved a little bit while longer so that the services that you're eligible for, you get. Helping that person to feel this sense of control, connection, and meaning. So a constant challenge, I would think, are people who are who don't adhere to their medication regime. The judge, the very first thing they say is, have you not been taking your medication? The person says, or they become agitated because they believe like they're not being believed or they're in trouble. If the judge meets with the treatment team ahead of time so that they know that person is not doing very well, the judge can actually be engaged with them potentially and say, I understand that you do not like taking your medication. Can you tell me what it is you don't like about it? And perhaps together we can come up with a plan that might work a little bit better. I have seen this happen. I'm a person in long-term recovery, so I escort a lot of guys that I work with, a lot of guys that I sponsor, and invariably, many of them are on medications to help them in their sobriety and in their journey. And invariably, they get asked, why aren't you taking your medication? You haven't been taking your medication. Instead of saying, and my guys tell me, they tell me, I don't like taking this medication because of X, Y, and Z. The way it makes me feel, the way it makes me behave, or the way it doesn't make me behave. I don't think we ever ask like, I think the medical community can do better in listening to people and listening to how they say, man, doc, this medication makes me feel worse when I take it. And sometimes we don't ever ask that simple question. Not always is that an option, right? For some people, that's what they have to take. And yeah, it's going to make you feel not so good, but here's what it does for you in the long run to keep you minimally out of the court system and out of the legal system. So what about a traumatized family member? Mother of a young woman with severe mental illness takes care of all of her daily living needs to avoid a situation in which her daughter might be rehospitalized. The treatment team has been ineffective in helping the mother understand that her daughter needs to learn to take responsibility for her own mental health and other needs. They're becoming concerned about her well-being as well. And the mom, usually when something like that happens, could get very emotional. When the treatment team raises the issue of mom, we've got to let your daughter be responsible for herself. And we know that this is a hard thing to do for parents who have that very codependent relationship with the person that they love, with their family member. And it's a difficult thing. Maybe an alternative could be pulling the judge into the conversation. Ask the judge to gently remind the mom that her daughter is under an AOT order and as such is responsible for adhering to her treatment plan. Commend her for what she's been doing. You've been doing a great job, Mom, but we have a treatment team, and the treatment team is here to help you so that you don't have to take this all on your own. And you got to let your daughter be able to grow. And sometimes that grow may means she's going to stub her toe. We'll be there to help put the Band-Aid on that stubbed toe. And I don't mean that in the literal sense of the word. Someone told me the ultimate definition of love is allowing people to stub their toes, right? We can't prevent people from stubbing their toes, but we can be there to put that Band-Aid back on or put the Band-Aid on. So she's free to be her mother and not her caretaker. And this has got to be incredibly hard, but we know how that really does not foster this sense of control, connection, and meaning, which is what we want to do for people who have presented with an SMI and who have experienced trauma and adversity, right? To be able to allow them, to the extent that they can, be in control, have a sense of connection and meaning. So again, we're talking about a sheriff pickup because the participant hasn't taken their medication for 6 weeks and is beginning to decompensate. Treatment team has asked the judge to issue a pickup order to take them to the crisis center for an evaluation. Immediately, the sheriff arrives. They place the participant in handcuffs and puts him in the back seat of the cruiser. Maybe, just maybe, someone from the treatment team could accompany the deputy to the home. And maybe an ambulance could take them rather than putting them in the back of a car, a sheriff's car, right? So we know that that way that person is being approached in and of itself could be triggering, and in and of itself could be re-traumatizing for that person. So there are alternative ways for which we might be able to accomplish the same goal, which is to minimize that person being re-traumatized again. So, what about trauma-informed practice? It's important that attorneys, judges, magistrates, and other court persons receive training on trauma-informed care and are well versed in these practices. And this is not a one-all be-all. This is not a 1-hour webinar about trauma-informed practice, but this is about actually how do we dig in? How do we get people on the same page to understand? Because if we don't, and I think back about this experience that I had with these attorneys that I trained from the city of Columbus, both prosecutorial and defense, who said, you know what, this makes sense. This absolutely makes sense. We get it. I understand it. Well, what about the system where someone is being tried by a jury of their peers, right? And the peers don't understand, like they don't care about this stuff. They haven't any reason to care because the system is saying you're here to go through this jury experience, right? So this is not a one and done. This really takes an investment of time. It takes an investment in commitment to say, you know what, we're going to be doing this a little bit differently. We're going to look at people a little bit differently than what the system says. Typically, this is how we do it. It's about building connections with other social services, and you do that. I think you do that well, most likely. Just because a person comes to the judicial system doesn't mean it's just the judicial system that fosters that response or that support. As Betsy mentioned, I've had a lot of different experiences in a lot of different agencies. It's not because I couldn't keep a job, but it's about, man, if we've got someone who's presenting with an SMI or a person who has presenting with trauma or adversity or both, the least of our problems is probably figuring out the judicial piece, right? It's all of the other things that help that person to feel, again, the sense of control, connection, and meaning, whether it's housing or transportation or employment, childcare, or substance abuse treatment. As I mentioned, this is not a one and done deal. You can't say I'm a trauma-informed court or I'm a trauma-informed legal system unless everybody in that system has a common understanding, has a common basis for which to all use the way that they interact and the decisions that they made a little bit differently, helping to understand that that backstory may be explanatory for some of the things that we're seeing in the people that come to court. So what can courts do specifically? Have formal policy and mission statements that say we're going to be a trauma-informed legal process or a court, and we're going to enfold that into our mission and vision statement. It's hardwired into the practices and procedures. It's done in all of the things that are written and published. It's a clear procedure for review of inappropriate social context, what happens when that happens, validates the importance of all staff. What about the environment? What are things that we could do? As I mentioned, I saw this happen in that juvenile court. They didn't put that person in a holding cell. That person sat outside and the deputy sat with them. Now, that was a smaller county, so they have the resource ability to do that. But I saw that heightened escalation in that adolescent who looked to me like this was not the first time he was coming to court. But the magistrate, the sheriff said to him, hey, The judge is going to be here in 15 minutes. We're going to get started. And you could see where I could see it. I could see the shoulders go from here to here because it was explained in the environment. And in that juvenile court, they had tons of artwork that students had produced. And I know that that's a juvenile court, but I think this could probably be done in the adult court or where there's just a different look to the environment. Lots of signage. There's benefit and there's research that areas, not just courts, but treatment areas, treatment centers, the more signage that people have so that they're familiar and they have that sense of control, the better it is. Engagement and involvement of people in recovery and trauma survivors, like we got to ask them. We got to ask them what their experience was like. We got to give them voice. We got to solicit opinions. We've learned more from people who have been traumatized and re-traumatized than sitting around doing some strategic planning. We got to ask them. We got to talk to them. What was your experience like? Training and workforce development, it's got to start with people that are being hired into the system. Do you know how to spell the word trauma? Can you give me a definition of trauma? So that when you say we're going to be a trauma-informed court, you bring people in whose philosophy is the same as you and what you're trying to do. Ongoing assessment for how are we doing in our practice using evidence-based screening instruments and assessment instruments, making sure. So here we know. So why are some people more traumatized than not? And a person's experience of trauma is affected by how, when, where, how often, and what happened next. That's a critically important or piece that I learned in doing the training, like the what happened next. So if my experience has been I've gone unheard and my what happened next is nothing was done, what am I going to think? I'm going to anticipate that this is not going to be a good experience. If what happened next was someone was responding to me and they helped me, I'm probably going to be more likely to be engaged. We know that people who have these things, and this is just a small list, training, humor, facing fear, having role model, faith and spirituality. The more of these things I have in my experience, the more resilient I'm going to be, and the less likely that those adversities are going to impact me. And this list is just an example, a quick example. So here's a telltale, and I told you from the beginning, this stuff affects us too, right? We think about the people that come to court. We think about how do we respond to them? What about us? And I cannot do a presentation about trauma or adverse childhood experiences without saying, look, you wouldn't let this happen to you. Every single one of you. Well, I don't know about you, but I make sure my cell phone is charged all the time, right? All the time. We have ways of doing that, really, really sophisticated ways. But what about ourselves? We don't do a very good job. I let my batteries die down all of the time, right? So we know that it affects us and it affects the way we think. And by virtue of the work that you do, you're repeatedly exposed to videos and autopsies and all kinds of things that just say, man, I need to take some time for myself. So we can't do any presentation about this without acknowledging the greater likelihood by virtue of what it is and who we serve that this can't have some effect on us. And then you have overloaded dockets and you have time limitation and you have to make decisions, but maybe not having the full story. Threats on your own personal lives, right? Lack of privacy in your own personal lives. So we have the part of like just coming to the job, but then here are the other things that add to it. So do good for yourselves. make sure that you do yourselves well and treat yourselves well. Here are some 3 resources. Betsy, is this PowerPoint going to be able to be, I mean, you could share this with anybody who would want it, or they could reach out to me, or so these are 3 websites that you could check out because they have lots and lots and lots of stuff about what it means to be a trauma-informed court, a trauma-informed approach, a trauma-informed legal system. So that's a real quick, what should be a very long and extensive look at this subject, but I think it's a way, as I mentioned early in that very early slide, this is a science of a new way of understanding. And, you know, really, quite frankly, I don't think it's a new way. I think we're all, by virtue of who it is we are and what we do, probably have gone for years and read volumes and volumes and volumes on people that we've served, cases that we've read, and then we still go home and scratch our heads thinking, I'm missing something, right? I'm missing part of the story. And so I think that that gives this, it's just sort of a 10,000-foot view about, don't forget about that story. Don't forget about that backstory that people bring with them, in addition to however they present, whether it's with an SMI or a substance use disorder or however they present. So awfully quick, 10,000-foot view. Are there any questions that people have?
Thank you so much, Kim. That was very informative. And I wanted to, there's a couple comments that I wanted to go through for you. So yes, we can definitely share the slides with attendees. Clarice says she wants a copy, and I'm guessing others want a copy as well. So I'll just reach out to you and get those slides and then share them. And Amelia comments that the alternatives that you presented were really great, and also says that social, economic hardship, childhood trauma, racism, ethnicism, exclusion, history of that particular place, failing a particular group of persons, or discriminating again and again, or simply deliberate malpractice or unethical, unlawful misconduct taking place in an institution. Also, trauma from the home, trauma from society, and trauma from institutions results in a loss of hope and the growth of anger and fear coming from all that trauma. And there's only so much the human body can take psychologically until the person has a serious crisis, which I definitely would agree with that. I don't know if you have any comments on that.
You know, I think the systems, now thankfully, the systems are becoming more and more aware. I've never been more involved in discussions with people saying, man, the court system has got to figure this out, right? Lots and lots of people are becoming more and more involved. And the fact that we've got people coming because of some criminal something, right, that triggered them coming into the system. And then life shows up for that person, right? And our systems, I think, tragically don't support us being able to do that yet. I think slow progress is being made, but it really comes down to the systems are funded, they're driven, you bill by a code. You don't really have time unless you stop and say, you know what, we're going to try and make a difference. We're going to try and make a difference. And I've seen this happen. I've seen agencies change the way that they interact with people. And I've seen them change the way a person enters. So kudos to the woman who just made that comment, right? So I've got my diagnosis, and then life shows up, right? And I've got all this other stuff that's going on, and all these factors that are just bearing down on all of us. So I think it's really critically important.
Definitely. Well, I
And
have a,
comment real quickly. Oh, sorry, Brooke, I didn't mean to
no,
interrupt.
no, go ahead.
But Kim, you were giving the example of the, walking into the courthouse and finding that, very overwhelming. And I was actually observed a program down in Kansas a few years ago. It was actually the AOT stakeholders all had got together for their quarterly meeting. And they were talking about one participant in the program, and it was shared by their case manager that this person could really benefit from spending, some time with a judge and getting, kind of that black robe effect. But she would get so agitated just going to the courthouse and going through the metal detector because of her mental illness. And so that she was losing out on that pretty, important piece of the AOT program. And so there was a sheriff's deputy there in the meeting, and she said, well, that's not a problem. We can just, let us know, that when she's expected in the court, and we can have her come in the back door, and we can just use the, the wand to scan her, So they were able to work around that because they had all talked about it ahead of time. So I thought that was, so I was glad you brought that example up.
So, and Betsy has been a part of a little group that we had, and I think Betsy, you were on when we had a lengthy discussion about what that looks like just because of how courts operate, right? Those people who are the metal detector guards there, right? Some are contracted, some are sheriffs, some are this, some are that. And what it said to me was, you know what? We've just done this for all these years, right? We're not going to change. And so kudos to, like, that's the kind of stuff that we need to hear. Like, yeah, we could do it. We could do it. We really can. If we want to make a difference. This is also really, I think this is also, and I say this loosely, but I think it's real. This makes our jobs easier. It really does. I don't have to think about all of this kind of stuff if I just realize I'm going to help this person feel in control, help this person feel a sense of connection, and help this person feel a sense of meaning, because they've lost that. They've lost that in their adversity and their trauma.
Yep. Well, and that's really what AOT is all about in a nutshell. Because that's what works, and that's what works over time. It's sustainable.
Yeah.
Another question for you, Kim. So we have someone who's asked, do you have thoughts on triggering parts of the process that seem difficult to move away from? So it can be traumatizing to feel trapped and unable to leave, but also it's going to be critical for the person to stay in court.
I've seen where, much like Betsy's example in that court, where people they took someone, in the back door. I've seen where they've actually used peers, right? Peers who were just warm bodies sitting next to another person. I've seen that be very, very effective. I've seen where using, I see the plants behind you. I've seen where people have added like plants, and I'm not saying, there is still a modicum of decor that needs to and should be there, right? Because this is a place where you have to go, and we're going to work on what the remedy is going to be. And so I'm not saying like make it all fluffy and little twinkle lights and all that kind of stuff, but there are using peers. We know the ultimate peer model was Bill W. and Dr. Bob, Bill Wilson and Dr. Bob in AA, right? That's how that program worked. And so I think using peers, I think using and looking at the way the courtroom is set up physically, just Google, like, and some of the, so you'll find some environmental things to look at, particularly on the Trauma Informed Courts, that first website up there. If you Google that or go to their website, there are specific things about how you just rearrange the way the court looks that helps people a lot.
Definitely. Well, another question slash comment from Jerry, who says her parenting experience of watching her son be processed through the system, including medical, carceral, courts, was that human beings working within all those institutions did not believe they had permission to act like human beings in their jobs. Their hands were tied by protocols, habits, policies, laws. How do these droplets of hope, water the system in a bigger way, that hopefully doesn't take decades?
This won't, so here's how I think this can change. This doesn't happen unless the administration is bought into it. Because we are so many times, we think we're trapped into these protocols and these procedures when, quite frankly, we're not. We're not. We're really not. And so the fact that we're getting a number of requests, we're developing this webinar series for courts here that actually be available nationally, I think, when we do it right, is that there is so much interest because whether judges, whether administrative, county administrators, whoever has the ultimate authority, they're learning. I mean, they're hearing from the people saying, hey, we should take a look at this. It seems like there's an opportunity for us to change here. And so I think in response to her question, this is going to take time, but the people who are asking the question, I think, are the right people who are asking the question. It's not the day-to-day staff of the court, right? It's the judges, it's the magistrates, it's the county administrators who are saying, there's something about this trauma stuff that there's something about this trauma shit that I don't understand, right? And I need to understand it, right? And so I think it's going to take a long time, but I think the right people are asking the questions that could say, you don't have to do that. You don't have to do that. Or who could say, hey, what if we try, or do you have a solution as to how we can try this a little bit differently, right? Sometimes we think, I sit around and I think about how the bailiff or how the sheriffs or the people who maintain the decorum and control, and like we think we know that, when all we have to do is like talk to that deputy who would say, oh yeah, we could bring her in the back door. Like, that's brilliant. That's brilliant. Imagine if we could let the people who are part of the system be a part of the solution, right? And I think coming around this as a team, and maybe just sharing with people in your courts this PowerPoint, like maybe that's the beginning part of how you have that open up that discussion, is what would keep us from doing stuff a little bit differently? Maybe that's the question. What would keep us from doing this stuff? This guy came and said, do all this warm, fuzzy stuff. What would keep us from doing that? I don't know.
Well, you kind of read my mind, because I was going to ask it, and you already kind of touched on this a little bit, but if you're a small fish, if you're not one of those decision makers, how, do you have any tips for kind of introducing trauma informed, I guess, changes to, I guess, an existing system that has ways that it's been doing things for a long time? I immediately think that your point about asking the people in charge themselves what they would like to do is a good one. But I was just curious if you had any tips, any other tips for that, for those on the call that may want to take some of this information back home with them.
So quite unintentionally, when we began this big focus in this trauma-informed care initiative in Ohio, we brought only the CEOs of our local mental health boards and superintendents, so only like the CEO folks, right? because organizational change starts with the top down, right? That's what all of the people way smarter than me would say. You know, it starts from the top down. My experience over the last 10 years has been wrong. It's from the bottom up. It's from the people who say, hey, I went and I listened to this thing and I wonder if we could try this one small little thing. I wonder if we could try just saying and presenting. I wonder if I could try bringing a person up the back elevator. Sally's coming in next Wednesday. Hey, could we bring her up the back, not the back alley, the back elevator, right? Or a different way of coming into the court. I think posing a question about could we try, I went to this presentation on trauma-informed approaches. Could we try a specific example? I think sparks the interest more than trying to, sometimes I've seen it where it really bubbles up from the bottom up, from the frontline people.
That makes sense. And I assume, you know, starting small like that, where you're not saying, hey, let's do this, this, and this. People are a little more resistant to those kinds of things. Well, that is all our questions. I'm going to give one more opportunity if people have any additional questions for Kim to submit them now. But other than that, I just want to say thank you so much. This was really informative, and I feel like the topic itself is something that I know I could be more thoughtful about, and how people's lived experiences impact the way they navigate the world. So thank you, Kim, and we'll definitely get your slides and share them with the audience as well.
And you know what? It occurred to me, I did not put the obligatory, here's my contact information on the slide. So when I send you the email with the slides, just you can copy my contact information if someone wants to reach out directly.
Amazing. That's great. I'm sure that's really appreciated.
Sure.
Wonderful. Thank you so much, Kim. Really appreciate this. It gives us a lot of practical ideas to think about and really make some positive change.
Thanks, everybody.
All righty.
Have a great rest of your day and a good rest of the week for one more day.
Have a good one. Bye, everybody. Thank you,
Bye-bye.
Kim.
Bye-bye.